right, welcome back. Now, according to the findings from the TB HIV Care Association, there is an estimated 67,000 injecting drug users in South Africa, and they are 28 times more likely to be living with HIV than the general population. In response to the drugs scourge, the association has developed a needle and syringe program that is called the Step Up Project. To tell us more about this project, we joined from our Cape Town studio by Shaun Shelly from the TB HIV Care Association, and with me here in studios in Johannesburg, I'm joined by Connie van Staden, who benefited from this program and is now working as the advocacy officer in Pretoria. Gentlemen, good morning to you and welcome to Morning Live.
Good morning.
Good morning.
All right, thank you so much. Shaun, let me start with you. Just give us a brief explanation of the program.
So the Step Up Project is a program that's funded by the Centers for Disease Control and some other funders from overseas. And what we do is we provide sterile injecting equipment to people who inject drugs. But not only that, we provide a set of interventions which are recommended by the World Health Organization and by the United Nations Office on Drugs and Crime and various other bodies. And this includes things like wound care for people, access to basic health services, testing for HIV, assisting people to initiate on antiretrovirals if that's needed. Recently, we've been doing testing for hepatitis C as well. And also, we help them navigate the health system as well. So we go to where they're at. They don't have to come to us. And among the services we provide, and probably the most controversial of them, is the needle and syringe program. So that's a small component of the program, but a vital and important one.
Yep.
So that's what we do.
All right. Although it is a little bit controversial, Shaun, you say the Step Up project has proven to reduce sharing of needles and unsafe injecting practices by up to 60% and to also decrease HIV transmission by up to 33% to 42%. How was this achieved?
Okay, so look, all the data comes from international studies. We're still looking at our data locally, but there's about 40 years worth of research into these kind of interventions that's out there. And look, the research is robust. It's very good. Yeah. And what happens is these kinds of programs stop people from, will help reduce the amount of needle sharing that goes on. Obviously, needle sharing is not very good. It makes the transmission of the diseases, especially blood-borne viruses, much easier, as you said, up to 28 times more easily than through other ways. And we've seen in a lot of countries around the world where they've implemented these programs, we've seen a reduction in the incidence of HIV. Tanzania would be a country like that, and we've seen it in Mauritius, for example. So it's not just Western countries, it's also some African countries. We're seeing it being rolled out in Kenya. And if we don't do something about it now, we're going to be sitting with a bit of a problem. We've seen very good results in our first evaluation of our project. And we hope that by the time the demonstration phase is finished, we would have seen significant changes in people's lives and healthier people.
Yeah, and we've recently seen a phenomenon called Bluetooth, whereby Nyaupe addicts are exchanging blood. But just before we get onto that, let me bring Connie into the conversation. Connie, can you just tell us your story as to how you became part of this association?
Well, basically, I was part of it since the very inception.
Yeah.
So they basically came and got us on the street and said they wanted to start a needle syringe program. And at that stage, you know, the practices that we had was, you know, we shared needles, used old needles, dirty needles.
All right, so you were living in the streets?
Yes.
All right,
yes.
Using which drug?
Using heroin.
Heroin.
I was a full-blown heroin addict.
Okay.
I've been using drugs for over 20 years.
Over 20 years?
Yeah.
Okay, and would you mind if I ask how old are you?
I'm 41.
You're 41. All right, okay.
And basically they started teaching us, you know, what's the best practices, how to inject, careful, and also the syringes. They gave us the syringes. And obviously they saw potential in me and they approached me and, yeah, they capacitated me. I'm also a lay counselor. Okay. I go out and do HIV testing and counseling as well.
All right, and how has the journey been?
It's phenomenal,
right.
Yeah. You know, people, when they're in that situation, you know, it's hopeless because people think they're going to be there and they're going to die. And when people see me, you know, they see hope that it can be done. Yeah,
it can be. It certainly can be.
Definitely.
Now, Shaun, Can you tell us more about the sterile injecting equipment as well? What do they include?
What the injecting equipment includes is basically, it includes syringes. There's also sort of alcohol swabs as well, sterile water, which is included, so that people can mix their drugs with the sterile water rather than with water that they found lying in the road or, from just taps, municipal water. And the objective is to make sure that people don't get abscesses, to make sure that people don't develop other problems, and they're not sharing needles, So the needles are an essential component. In fact, I would say not only are they an essential component, but people don't like reusing needles. It's very painful to reuse needles. And so it's not a case of people not caring, it's they would prefer new needles. And so that also helps bring us into contact with people because we've got a commodity that they need and they come to us and we're able to show some compassion to these people and help them in other areas of their life and certainly help improve their health situation. Things like abscesses and that. In South Africa, we often see people dying of things like untreated TB, AIDS, and septicemia, simply because they haven't had access to the medical services. And we're a bridge for that, I think. And I think that's one of the great valuable things about the project.
Now, Shaun, I'm sure you've seen the new phenomena that is taking place in Pretoria, whereby addicts are exchanging bloods, of course, using needles. They term it a Bluetooth. What is your take on that?
Yes. Well, Bluetooth isn't actually that new. We've had anecdotal stories about it for a while. We've tried to keep it quiet. Certainly in East Africa, we saw a report in the British Medical Journal as far back as 2005, and then there was another fairly comprehensive report last year in 2015. But in South Africa, we hadn't actually seen it happening. We'd heard about it, but we hadn't seen it, and then suddenly the story broke in the press.
Yeah.
The thing about it is that, first of all, it doesn't work. People say, oh, well, we use the blood from another person because it's got heroin in it and it stops the withdrawal or it gives us a better high. Absolutely untrue. The only effect that they get is a placebo effect. There is not enough heroin in that blood to prevent the withdrawals. So we've got to correct that misconception. Otherwise, people are going to do it because people are desperate. When they can't afford drugs, this is one of the things they're going to do. The Tanzanian studies have shown us that it's only the most marginalized of groups that actually pursue this in a desperate attempt to avoid withdrawal. So I think that's an important issue to let people know that it actually doesn't work, and secondly, that it's very, very dangerous. In terms of, it's not going to result in an instant death like some people have reported. Mm-hmm. What it's going to do, though, is it's going to ensure that you very effectively transfer HIV, hepatitis C, and other bloodborne viruses and diseases, and that could eventually end up killing you. And we need to sort of introduce interventions such as widespread opioid substitution therapy, which will reduce the levels of injecting and make, the issue of withdrawal something which people don't have to go through. That's what we should be looking at.
Okay, gentlemen, thank you so much. That's where we're going to leave it for this morning. Thank you very much. That is Connie van Staden with me here in the studio, who benefited from this TB HIV Care Association program. And we're also speaking to Shaun Shelly, who works for this program as well. Thank you so much.
Thank you so much.
All right, there you have it. Let's take a quick break. When we come back, I'll give you the 7 o'clock news bulletin.